fibromyalgia, I think, is something that we deal with a lot more than what is reported, specifically because there's such pressure on us during December. With all of the parties, all of the planning, the Christmasing, the eating of the things that are very sweet, sugary, all of this can lead and increase fibromyalgia. So I think fibromyalgia literally would be a barometer of how well you're eating. It can be painful throughout, and I think that's very well depicted with this little voodoo doll. The pins and pain in anywhere, any part of your body. So I'm excited about this topic. Well, my name is Troy Giles, and it is Christmas time, and that was kind of a fun little concept there with the Santa hat. But I've been practicing now for 23 years here in Bountiful, Utah. I'm about 40 miles south of Inno-Vita, and I love teaching other doctors how to expand their practices through nutrition and other work that we do. So fibromyalgia, some misconceptions, and I think this is, we've all seen this. Fibromyalgia isn't a real disorder. Fibromyalgia is a wastebasket diagnosis. Fibromyalgia is a hypochondriac fantasy. Everyone with fibromyalgia has the same symptoms. Fibromyalgia and chronic fatigue syndrome should be treated the same, and fibromyalgia isn't really treatable. These are some of the misconceptions that are there. When I say it's a wastebasket diagnosis, many times the other people within the medical profession put that patient in that set of symptoms in, I don't know what else to tell you. You think you got fibromyalgia, and here's Lyrica, or here's a painkiller of some type, and basically they want to move those kind of patients on out of their practice because they are difficult. There's such a multifaceted concept. But let's discuss more about what fibromyalgia is and how it goes differently. So chronic fatigue syndrome and fibromyalgia are very similar, and I think actually chronic fatigue, of course, is one part of fibromyalgia. But we'll discuss that as we go. So our bodies have a major north and south corridor, like an interstate highway. So you say, well, I-15 is an interstate that runs north and south, and that's right here, right by my office. So that would represent, as these cars go up and down the interstate, that represents a blood supply. Off of the interstate, off the sides here, off these exits, would represent the blood flow of basically a 10% outflow of blood volume to travel out of the arteries and into the lymphatics. So the lymph is basically the side streets. So 10% of this fluid becomes plasma, which is carried throughout the smaller connected streets, also known as the lymphatic system. So you've got cars, and you've got nutrients, you've got carbohydrates, proteins, fats, all of that's running within the arteries, but that has to leave the arterial and the blood supply and come out into the side streets, which would be the lymphatics. So the lymphatic would be more of the plasma, the clear fluid. So delivery trucks on the city streets deliver nutrients to the city houses, or otherwise known as cells. So here comes a delivery truck. It brings nutrients to the cells. The cell uses those nutrients. It does its normal function, cellular respiration, all of those things that are happening. But then it also gets rid of its garbage with a garbage truck. So the garbage truck basically carries the garbage out and back into the blood supply. So the garbage trucks return to the interstate to take the collected toxins to the burn plant or the liver to be detoxified and excreted in the urine and feces. So here comes the garbage truck here up to the liver, and as long as these pathways are moving well, everything's fine. But sometimes, if there's an accident on the on-ramp or backed up lymphatic blockage, the garbage trucks then cannot enter back onto the freeway. So you can get stuff that's stuck within the lymphatic system, and that would be considered a lymph node, or a lymph node that's starting to swell, because you've got stuff that's stuck. It's either stuck because of inflammation, because of layers of infection, or backed up dead white blood cells. Many different things can cause those lymph nodes to become swollen. So now those toxins end up, instead of being able to drain through the side streets and back into the blood supply and then become and detoxified in the liver, it'll get stuck here. Well, now the stuff starts to ooze. So temperatures of 98.6 basically will stop that flow. So 98.6 degrees causes sweltering, and the garbage truck begins to ooze garbage onto the street, creating more toxins. This, in my opinion, is fibromyalgia. That's the concept. And where that sits there and just stops, and that those toxins will back up, you get a lymph node, and it might not even be a lymph node that appears, but you'll get painful to touch areas. You'll get turgor or swelling. So this is one of the reasons why in my office we employ lymphatic massage, and I use a machine my massage therapists do that's called the LymphStar Pro. And what the LymphStar does is helps to break up and literally cause this to break up. And how it does that is it bombards. These blockages can also be from undigested proteins and water bonding. So as that undigested protein mixes with water, it will create a larger molecule that's stuck together with positive and negative ions. So it's actually electrically charged. So this garbage truck now, this lymphatic nodule, will get other proteins and things stuck, and then you get more increase and more increase. So the LymphStar Pro breaks the bonding between the positive and negative charges, so the undigested proteins will be released from the water, and now it can start to drain and move. So the oozing of the garbage truck is fibromyalgia. So the toxicity inflammation of the lymphatic nodule is the reason for the pain. So that is the concept. That's the idea of the fibromyalgia. So fibromyalgia is also called fibrositis. So fibrous tissue, because of the toxins, those tissues will become burnt, if you will, more inflamed and actually come into more of a fibrous material. And itis means inflammation of that tissue. So fibromyalgia has been misdiagnosed for years. Many patients are diagnosed with inflammatory arthritis such as rheumatoid or lupus, and depression or other pain problems. So it's so multifaceted that there's misdiagnosis all the time. Or it's called one thing, but in reality, lupus and all the other things, rheumatoid arthritis, yeah, there's rheumatoid factors there, but there are other things as well. So for decades, other practitioners have believed that fibromyalgia to be the result of emotional hysteria, because, as we'll see here in a minute, there's a preponderance of women in childbearing years who have fibromyalgia. So they're thinking, well, that's just a female that's hysterical or has, like Peter cried wolf. That's not it at all. So fibromyalgia is often misdiagnosed by the medical industry, chronic exertion or chronic fatigue syndrome, because when you exert a little bit, it overloads everything. It overloads the adrenal glands, it overloads the muscles. The muscles are trying to get rid of lactic acid, but they're unable to because there's blockage in the lymphatic system. There's a sense of swelling, and we'll see that here in a minute as one of the other symptoms. So because it's so multifaceted and symptoms are found in many other conditions, practitioners have to be careful to make an accurate diagnosis. So symptoms of fibromyalgia, also called fibrositis, include chronic muscle pain, spasm or tightness. That's usually the primary complaint. Also fatigue, moderate or severe decreased energy, and then sleep problems, like they're waking up just as tired as they did before. Also painful tender points or trigger points, abdominal pain, tension or migraine headaches, jaw and facial tightness, anxious or depressed, numbness or tingling in the face, arms, hands, legs, or feet, increased urinary urgency, reduced tolerance for exercise, and feeling of swelling without actual swelling. But when you realize that it's backing up, that fluid is backing up behind the nodule, the lymphatic issue, you're going to feel that swelling. But maybe you're not going to have swelling like in the feet, but swelling anywhere, wherever that blockage is. But you're not actually going to see the swelling. It's just a sense of swelling. But you think about this, that's all right there down the line. So numbness and tingling in the face or hands, arms, legs, or feet, that can be because the toxins are backing up around the nerve tissues, and now you're sensing the tingling. It's also because it's chemical. It's chemically induced pain or swelling around those nerve tissues as well. So consider these conditions that mimic fibromyalgia. So fibromyalgia can coexist with these and other conditions. So rheumatoid arthritis, hypothyroidism, hepatitis C, polymyalgia rheumatica, cervical and low back pain degeneration disease, endocrine disorders, Lyme disease, chronic fatigue syndrome, sleep disorders, depression, cancer, HIV. Well, at what point or in what system do you have degeneration that creates that particular symptom picture? But if you think about it, if the lymphatics are blocked, that's going to cause all kinds of physical blocking of the lymphatics, as well as chemically blocking of the lymphatics. When I say chemical, I'm talking about the chemotactic agents that come to that area because of the inflammatory states, because of the layers of infection, because of the undigested proteins. You're going to also have chemotaxis to that area, which then is going to create more inflammation and more pain. So I think this is a great picture here. This would represent a lymph node, and this possibly is nerve tissue. So because the lymph node is oozing toxin, like we had from the back of our garbage truck, now these nerve fibers are becoming irritated, and now you're sending off pain all over the place. It jumps around. That's not in a specific point. It's not in a joint. It's in the center of a muscle, and therefore we're thinking about the polymyalgic rheumatica. So that's, poly is many areas of pain and surrounding joints or surrounding muscles. Okay, so the differences between the fibromyalgia and chronic fatigue syndrome. So pain is chronic and widespread, associated with stiffness, tenderness, or tender points, and triggered by trauma, and less often by infectious processes. So that's fibromyalgia. Where chronic fatigue is most profound. It's the biggest area. It can be completely incapacitating, the fatigue, and sometimes triggered by flu-like or infectious illnesses, surgery, or trauma. So chronic fatigue has more of an infectious issue, where fibromyalgia has more of a lymphatic issue. But see, there again, you're going to have a lymphatic issue as well when you're talking about infectious issues. So it's kind of hard to distinguish between the two. So here you go. It affects 3 to 6% of Americans, or 1 in 50. It's the second most common ailment affecting musculoskeletal systems. 80 to 90% are primarily women of childbearing age, but has also been found in children and men. So this is why they're thinking hysteria. Well, these women are just hysterical women that are having children and blah blah blah. Well, think about that. What's the most intense thing that a woman can do is bear and raise children. And as that happens, her body becomes less and less in integrity, if you will. It's being sucked, if you will, dry. It's every nutrient, whether she is nursing her children, all of that is going to be drawing from her. So that's why I always give extreme respect to my wife and to other women for what their bodies do in order to propagate our human race and our children, our families. 25 to 65% of fibromyalgia patients are found with other systemic conditions. I would say all of them. If you have fibromyalgia, you've got other systemic conditions as well. Fibromyalgia patients 50% more likely to suffer from depression. Well, yeah, you've got a lot of pain everywhere. You can't see an end. You can't see a way out of it. So yes, depression is, and there's painful, and it's causing loss of good function in the brain and thought pattern. People with fibromyalgia are hospitalized on an average of every 3 years because of the intense pain. Well, we just want to give drugs. That'll cure it. Well, these drugs, the FDA has approved drugs for fibromyalgia. Currently, the following drugs have been federally approved for treatment: Cymbalta, Savelia, Lyrica, Effexor, Celexa, Prozac, Paxil, Pamelor, and immunoglobulin injections. Now, everything here are affecting neurotransmitters and affecting neurologic function. So if you can stop the neurologic receptors, then you're not going to sense the pain. So all we've done is just blown the smoke away. Yes, it can help some people not have pain, but the overall ecology of the body continues to spiral downward. There's going to be more and more symptoms continue, because all we're doing here is shutting off the synapses and shutting down the propagation of pain along the nerve pathways. But this one here, the immunoglobulin, So you're giving them immunoglobulin injections. That kind of makes a little bit of sense because you're trying to boost the immune system to get rid of possible layers of infection in the lymph nodes that would be causing some of the pain. So I can kind of understand this one and understand this one as well. But sometimes maybe the Cymbalta might help while you're getting to cause. So if your patient is on this, of course, as a chiropractor, I don't have the authority to take them off the medication, but I can say to them, I would encourage you to talk with your doctor as we clear this, as we bring homeostasis back into your system, as we clear the garbage truck wreck, so that your lymphatic can flow as we do lymphatic massage, and as we do other things that will get rid of toxin. Now let's see about coming down off of some of your medications. So I always give respect and to the medical profession and say, make sure that we're talking with your doctor about how to come down off of this. If by chance they say, I don't want to go back and I'm not going to do it, then I'll tell them, then on your own accord, on your own recognizance, you are going to come down off this by yourself. But if it were me and if it was the way I would come down, I would half it, take maybe over the next 6 to 8 weeks and slowly come down off your medication, and that will diminish any reaction and any Hersheimer's reaction of detox. Okay, so in multiple surveys, about 22,500 patients revealed the most common factors perceived as worsening their fibromyalgia. So these things worsen. So the number one concept, emotional distress. So here you're thinking, yeah, when I have stress with my children, my fibromyalgia picks up. Yes, because when you're stressed, when you have emotional stress, you're releasing all kinds of chemicals, and your muscles are tight. You're in an uptight fight or flight mode. You're sympathetic dominant. So all those things are going to put more stress on the system, more acidity in the system. Weather changes. Now, weather changes, I'm sure you know this, but take a second and explain to you why this happens. Why weather? Why people say, well, yep, I know that we've got a storm coming in 2 days because my knees hurt. During normal barometric pressure, during a high pressure, you push the pressure from barometric pressure is pushing on your tissue and making it so that it doesn't swell. So if you have high pressure, your joint, your knees or your hips or wherever you've got pain is being pushed and compressed, so there's not as much swelling. As the low pressure approaches, you have less pressure on the joints, on the tissues, and you'll begin to swell and more fluid will come to the area. Again, more chemotaxis and more inflammation. So that's why weather changes. It's literally a barometric pressure on it that's an issue. Sleeping problems. So if you're not sleeping well, you're not having enough time to regenerate. Strenuous activities, because with activity you're trying to get things to flow. But if you're pounding and you're pushing and you're pushing your adrenal glands to move and you're getting fluid to move, that will back up again behind the broken down or the garbage truck concept. So you're going to start causing more hydrostatic pressure behind that area of blockage. Mental stress, worrying, again, these are going to cause you to become more acidic, and more acidic equals more inflammation. Car travel, because as you're traveling in the car, your body's constantly trying to right itself to the horizon, and this causes extra pressure on the endocrine system. So it's going to cause more pressure on your thyroid, your adrenal glands, so forth. Family conflicts, right back up with the mental and emotional stress. And in physical injuries and physical activity, when your injuries, when your body's trying to recover, you're going to have more chemotaxis, more inflammatory states are released into the blood to try to heal. Whenever we're injured, inflammation is a normal process. But with the inflammation, with mast cells, for example, when they're released, now you start to have inflammatory state. So when you're inflammation, of course, the areas that are already inflamed are going to inflame more, which causes more pain. So recent studies show these concepts. Fibromyalgia and celiac symptoms overlap. Think about that. Celiac disease, again, your celiac means you're having inflammation in the gut because of the phenolic compound of the celiac, of the gluten. So celiacs are literally allergic to the phenols. So gluten is a phenol. So if you have celiac disease, you're allergic to the phenol of gluten. So IBS and fibromyalgia are very, very, very common. They're going to link up together. Neuroscientists discovered brain changes within the fibromyalgia, suggesting these are symptoms rather than causes of the condition. So again, it's going to cause inflammation. Brain isn't going to work as well. Neural pathways aren't going to work as well. So when you to start thinking about fibromyalgia, also go back and restudy the previous webinar we did on leaky gut syndrome. So that's very important there. Muscle relaxants or opioids don't help. So combined with NSAIDs does not improve back pain of people with fibromyalgia and back pain. So that's interesting that the opioids don't even help. Fibromyalgia sufferers find some relief in vibration exercises. Now this is interesting. Vibration is going to help lymph open. So you think about a vibration, that's one way you can get that lymphatic nodule to open and move and start to flow more. And it also, vibration also helps to calm or overstimulate and finally exhaust nervous impulse. So that would make sense. Researchers target sleep patterns for fibromyalgia. So deep sleep brainwave patterns are disrupted, causing more pain. So unless we're into the REM sleep, we're not getting the chance to heal. So the treatment, I'm always going to go into leaky gut syndrome when I'm talking about lymphatic, because you're leaking toxins here through the leaky gut, which is then those toxins are passing up and finally getting stuck in the side streets. And that when those toxins get stuck there, that's now the garbage truck can't leave, it can't exit and get out and go up to the burn plant. So you're going to start it. So fibromyalgia should begin with treatment of leaky gut. So you got to think about the toxins, how that overloads the liver, and ultimately the lymphatic system. So these tissues become hardened, toxic, and painful. So refer to that previous leaky gut seminar that we did previously. So the formulas that we're thinking about when we start to work in the gut is Coltrax. We want to support the colon so that the hyperpermeable areas can be closed up. So this diagram represents hyperpermeability of the colon. On the left, this is tight. These fissures are tight, and it's making it so that the toxins cannot pass through. This would be then semi-permeable. And the villi are nice and strong here, so that's going to help you so that you're absorbing more effectively. You've got a good count of bacteria, so you're digesting more effectively, versus a leaky gut where the villi are shrunk. There's much hyperpermeability and things can pass through. Liver G will help support the liver and its ability to detox. Kidney Clear supports the kidney and its ability to detox out of the kidney and remove things out of the blood. X-Spleen works with the lymphatic system and the spleen itself, but the lymph basically goes through, one of the major filters of the lymph is the spleen. And then Digesta, taken on an empty stomach, will help digest what's in the blood and in the lymphatics. So this would be like Drano in the lymphatics to try to break those blockages out. So Digesta has digestive enzymes protease, lipase, and amylase. Protease for protein, lipase for fat, amylase for sugars or carbohydrates. Adrenex, because of the intense fatigue and the overall dropping of the mojo, dropping of the body's ability, its constitution. So the Adrenex helps to repair and bring up energy. Zenadapt is an awesome supplement that helps diminish stressors on all internal organs, and specifically helps to balance the endocrine system as well. So Zenadapt is going to be tremendous for supporting all internal organs. So fatigue is also part of fibromyalgia, indicating possible adrenal gland burnout, and adrenal fatigue may also lead to an overall endocrine system malfunction, causing the same symptoms. So you got to think about what the female body that's childbearing has just gone through is a total upheaval of the endocrine system. So Zenadapt and Adrenex and any of the support formulas for the endocrine system, thyroidin for thyroid, pituitin for pituitary, hypothalamic for the hypothalamus, Femiferm and PM Sync for the female, Manaferm for male. Here's a quick clue as well. Don't always think the Manaferm is only for females. You might consider Manaferm to increase the male aspect of the endocrine system in a female as well. CalComp, this is calcium and other minerals. So the mineral considerations. Vitamin D should be about 6,400 IU, international units. And vitamin D2, ergocalciferol, this is due to the pain. Fibromyalgia sufferers may get less vitamin D when normally exposed to sunlight. So this is going to help you with your overall vitamin D and D2. Magnesium, 80 milligrams of magnesium helps with muscle weakness and also muscle relaxation as well. So additional magnesium can be supplemented too, but magnesium 80 milligrams there. Calcium, so muscle aches and spasms can also be due to a lack of calcium in the food or malabsorption. So calcium helps relax the muscle fibers. So CalComp is also very effective. Working with layers of infection is really, really important as well. Layers of infection can get stuck within the lymphatic system. So we've discussed this previously, but Bacto-X, Meta-X. So Bacto-X is for bacteria. Metals, or Meta-X, is for the metals and heavy metals and chemicals. Microcyte is for microparasites, those that need to be seen with a microscope. Paramac is for large parasites, those that can be seen with the naked eye. Fungex drops the ability for fungus to propagate, so the fungus ends up dying of old age. And Virowex works with both DNA and RNA viruses, stopping their replication. So all of these can become layers of infection that can get stuck in the lymphatic system, stuck in the lymph nodes, and back up, creating chronic inflammatory states within the lymphatic system. Now you've got fibromyalgia. So as far as layers of infection go, and their contribution to fibromyalgia, here is what we give. So also with the treatment, detoxification is critical to treat fibromyalgia. And fibromyalgia is a conglomeration of many symptoms of fatigue and overall toxicity. So I would also encourage that give IntegraCell. And IntegraCell is a tremendous supplement acting as an antioxidant. IntegraCell, if you haven't heard to this point, per scoop gives you 8,000 milligrams of type A antioxidant. Type A antioxidant will knock off 1 million free radicals per milligram. So 8,000 milligrams per scoop times 1 million equals 80 billion free radicals that it's going to knock out. So if we can diminish free radical damage in the whole system, now you're really going to be working and detoxifying, getting rid of, and helping with fibromyalgia. So IntegraCell is a tremendous support right here with detoxification. So the protocols, again, I always encourage you to look and watch our kinesiology video. You can go to YouTube, looking up under Inno-Vita, and there is the kinesiology video that I did that explains very easily how to check a patient using kinesiology to determine how many they should have. But as a rough protocol, for the first 2 to 3 weeks, 1 to 4 capsules Coltrax, take 2 capsules upon rising and 2 capsules upon evening before bed with Livergy. Kidney Clear 1-4 times a day to support the kidney. And Tox-X as a chelating agent. Again, chelation is when you're bringing a small molecule and making it become a larger molecule by combining with other toxins, which makes it so that it can get stuck in the kidney and liver net and excreted. So Tox-X is a tremendous supplement that we give whenever we're working with layers of infection, or whenever you think you're going to create a Hirshheimer's reaction. It's best to use Tox-X as a chelating agent, along with IntegraCell. Hypothala, pituitin, adrenax, and thyroidin would be for the concept of the endocrine system, realizing there is that endocrine part. That's why it's so mostly predominant in women childbearing years. And it's not because they are hysterical. So this is, you can see kind of how to take this as well. So I have a lot of energy and a lot of passion with fibromyalgia because I see so much of it. We all see so much of it. And now I hope that that's been able to give you some concepts. The other idea, and this needs to happen in my opinion, is you've got to get the lymphatics to open. The lymph massage is a very light massage. It's not a deep muscle tissue. It's just very, about, I don't know, maybe the weight of a quarter is all, rubbing the skin. You wanting to moving that massage, first off working in the abdomen in a clockwise movement to get things to start to flow in a clockwise, dumping it into the colon or getting that motion of clockwise movement in the abdomen. Then you would work towards the periphery, working in the inguinal area, down into the thighs, down into the calves, ultimately to the feet. Same way up through the breast tissue, the chest, down the arms, and into the forearms and hands. But each time you bring a stroke up, bring it all the way up and into the abdomen. Bring it all the way up from the arm, across the chest, down into the abdomen. This will get that flow to move more effectively. So ascites is fluid buildup. So if you have ascites in the liver, it just means it's swollen, it's not moving. So from the liver, it's going to detox and dump into the colon, dump into the kidney, and on out. So we'd want to support, for sure, support the liver with Liver-G. You would want to be careful. You have to kind of be careful with lymphatic massage as well, because if you've got backup into the liver, you're not wanting to move it towards the liver. You'd want to try to move things away from, even though you've got blood flow. You know, you've got blood flow coming back up through the up to the liver. You're still wanting to try to get it to move and dump into the colon. So as I was taught with lymphatic massage, that's why we always would go in a clockwise movement in the abdomen to get that to start to draw back into the colon. You see, lymphatic fluid is omnidirectional. So it goes everywhere, which goes both forward and backwards. So there's not really a directional flow, but we try to get it to draw back up towards the center and into the abdomen, hopefully getting it to go towards the colon. So I would also think about kidney clear, increasing the kidney's ability to draw and get toxins or draw fluid, draw more urine out, for sure. Again, I would think of Tox-X to pull and relieve pressure off of the liver. But if the liver is swollen, then we need to also think about what's causing it to be swollen. Is it something the patient's reacting to? Have they had, maybe there's microparasites in the liver? Something's causing it to be swollen. But I would try to draw as much pressure away from the liver as we can, not only hydrostatic fluid, but also taking pressure by supporting the kidney and maybe colon. We would want to do Coltrax to get it to make sure that it's moving and dumping 3 times a day. You should have 3 bowel movements a day or so. That would also take pressure off the liver. But ascites in general, that's just abdominal swelling, abdominal fluid in the wrong compartment. It's fluid in the lymphatic system. It's boggy. It's a bayou. It's a swamp. So people, when I get ascites, I explain to them, you know what, you're kind of swampy. And I had a gentleman one time say to me, did you just call my wife swampy? And I said, well, yep, that's exactly. You got it. You just understood what I was just saying, that we want to try to drain the swamp, drain that extra fluid away. And a lot of times with fibromyalgia, they're going to have, they will have ascites for sure. Yeah, so it sounds with the diarrhea and the blood in the bowel, that would be ulcerative colitis or Crohn's, or many other things. But the watery bloody diarrhea is a big deal. I would again, concurrent treatment with a medical doctor. I would see, have them do a scope, see what the scope shows. They can also do a CDSA ×2, complete digestive stool analysis. It used to be Great Smokies ran that lab, but those are about $600 to find out what are the life forms within the colon. But definitely you need to start to think about putting this patient on a strict diet, do maybe a modified elimination diet where you're just giving them, first off, finding out kinesiologically what they can eat. So maybe you start with white rice and maybe some applesauce. and eliminate everything else after that. Maybe they could do white rice, bananas, and applesauce. Lots of fluid. Then maybe after that, check to see if Leptera would work, Leptera from Inno-Vita, and so that it'll make sure that they're getting the good bacterias, the digestive enzymes, the instantized rice protein, all of the amino acids and minerals. Leptera is phenomenal as a meal replacement, but I would eliminate everything that you could of anything with anything fibrous for the first probably 4 to 6 weeks it might take. I would also do large amounts of aloe vera juice. They can get distilled aloe vera juice, but aloe vera is very good at shutting down inflammation in the gut. Yeah, bone broth would be good, but you always have to check it kinesiologically. If we can get past the idea that kinesiology is voodoo, and just help them understand that we've got to inquire of your body. We have to query it to find out what is best. What can your body handle? So if we're giving them things that we think are good, let's give them a bunch of spinach juice, because spinach is what feeds Popeye. Well, they might be allergic to spinach. We've got to find out if there's an allergic issue here. So this person with this bloody diarrhea would probably, for sure, have fibromyalgia. There's almost no way he or she wouldn't. But really give them so that they're hardly eating anything to get that bowel some time to rest. Looking at the layers of infection, slowly working into as they can, getting rid of the infection. But I wouldn't do the infection until after you did some cold tracks, because we want to try to tighten it up and heal the gut before we start into infection. But the infection would probably is the cause, but you would want to support the integrity, getting it to be less permeable, getting it to be semi-permeable before we do detox of the layers of infection. The liquid extracts are much easier to digest, much easier to absorb, because they're in a liquid extract. They've been extracted in 3 different ways, so the body can absorb those more easily. So yes, think about that with Coltrax, Livergy, Digesta. Yes, that for sure. Whenever you got immense diarrhea, you just have to pull them way back, and then add one food at a time. If you're going to try something, check them kinesiologically first, and then have them before they eat whatever they're adding. Let's say they're going to add potato, or maybe they're going to add a sweet potato. Take their pulse before they eat it, and then eat it, just that one thing, a sweet potato, and then check the pulse again 10 minutes later, and if the pulse has risen 10 points or more, then they're reacting to it. So we've got to shut off their reaction in the gut as well.